years ago, we set on a little venture to try to create a patient process that was unparalleled in terms of experience, satisfaction, and those kinds of things that patients really want to do. So we put together our ideas, we've embedded them in an architectural design in our new Moorhead clinic. Now, we borrowed concepts from a number of places across the country, so we're not the first people to do this, but we are part of a very small group of clinics throughout the country that are attacking the issue of perfecting patient flow. We designed our building using a concept that Disney uses, onstage, offstage. When they talk about their customer experiences, they talk about only having people see what they want them to see. Our clinic is based upon onstage, patient-only areas, and offstage. Those are staff-only areas. Our onstage areas are filled with natural light, quiet, simplified wayfinding. You turn once to find your way out of the building. Our patient-centered exam rooms are really designed for the patient mind. They're very standardized throughout our building. We can change the function of these rooms in just a matter of minutes, going from pediatric to adult if we have to. These rooms have a door on the offstage side and the onstage side, so the patient enters from their area and the staff enter from their area. We want to keep these areas separate. Team space, this is offstage. Here's our control center. There are nurses and doctors who sit together all day long to make sure that we collect the right information, we do the appropriate planning, we coordinate your care. We're an integrated clinic. We have behavioral health on site in the clinic to help address those kinds of needs that may be special in nature. When I check in, I have choices. I can register with a normal individual like I can, or actually I can go to a kiosk in the future and I can simply get my tag. We use RTLS in this clinic, real-time location system. It helps us monitor those events in patient flow that oftentimes we don't monitor and they get a little bit out of hand, creating weight and waste for our patients. So, what's this going to look like in 5 years? So I want to invite you to go on a little imaging trip with me. You're going to come to my next clinic appointment, and it's going to be about 5 years from now. I'm walking into the building, and I have a choice. I can be greeted by someone, I can register, get my tag, or I can go to a kiosk and swipe my Sanford card, and I'm going to get a little card like this with my room number on it and my badge, and I'm going to be instructed to go directly to my room. Right now, 75% of our patients go directly to their room. We have 4 chairs in our pediatrics area that people can wait. All of this is based upon the right kind of flow, the right kind of time, and all of those things. I'm going to go into the room, I have my badge, my nurse knows I'm on my way to the room because my information is going to show up on a status board off stage. They know I'm on my way. They know they have 3 or 4 minutes to get in the room in order to meet me. When I'm in the room, nurse comes in, the doc knows the nurse is in the room. So then the doc can just simply say, hey, I've got about 5 minutes before I need to be in the room. Doc comes into the room, greets me, starts to talk directly to me. When he comes in the room, his badge opens my chart. He's not sitting on the chart kind of opening it like that. So what we really have is we have a value-added visit. His conversation with me is recorded actually and transcribed by voice recognition software into the medical record that forms the family and social history. His discussion with me about medications, and he says he wants me to stay on them, that goes directly to the pharmacy and reviews my medications, so it's not a frequent kind of shuffle for the doctor. He says, Mr. Haas, thank you so much for letting me take care of you. My electronic patient record closes the chart, codes the chart, and sends the bill to my insurance company. I'm totally engaged in my care because my 20-minute visit, 19 of those minutes was my doctor paid attention to me about my issues and what I was concerned about.